Explosive allegations against Texas Health Presbyterian by the National Nurses Union. And now the CDC is scrambling to try to identify and monitor nurses who were exposed to Thomas Eric Duncan during a 3-day period before he was diagnosed with Ebola. Hospitals all across Dallas are understandably ramping up, and Fox 4's Sean Rabb has our story.
This is the critical isolation unit at Emory University Hospital, Atlanta, one of only 5 in the U.S. CDC certified. It was home to Dr. Kent Brantley as he fought Ebola, and now will be home to Amber Vinson, the second Dallas nurse to contract the disease. Vinson and nurse Nina Pham, who is improving, both had exposure to Liberian Thomas Duncan, who died from the virus during a critical window in his treatment.
The first several days before the patient was diagnosed appear to be the highest risk period. That was the 28th, 29th, and 30th.
Now the Centers for Disease Control trying to find out how many other healthcare workers had exposure to Duncan during that time frame.
Nurses had to interact with Mr. Duncan with whatever protective equipment was available at the time, when he had copious amounts of projectile vomiting, diarrhea, and other bodily fluids coming from his body.
The National Nurses Union blasting Texas Health Presbyterian in a teleconference.
Hospital officials allowed nurses who interacted with Mr. Duncan to then continue normal patient care duties while taking care of other patients, even though they had not the proper equipment to personal protection equipment while providing care for Mr. Duncan.
Saying the hospital had no protocol for handling Ebola patients or protecting healthcare workers and other patients. Duncan, they say, left for hours, not in isolation, but in an area where other patients were present. And they say his lab specimens were sent through the hospital tube system instead of being sealed and hand-delivered, potentially contaminating the entire system.
There was no one to pick up hazardous waste as it piled to the ceiling.
I don't think we have a systematic institutional problem.
At a news conference announcing the second Presbyterian nurse with Ebola, Texas Health Presbyterian's Dr. Daniel Varga would not address the allegations brought by the Nurses Union, but did say,
"We're a hospital that may have done some things different with the benefit of what we know today."
CDC Director Dr. Tom Frieden.
We're also planning for other eventualities.
Baylor, Methodist, Parkland hospitals are as well. Baylor with 4 isolation rooms, Methodist says it has about 10, and Parkland with 4, in case more patients present with symptoms than Presbyterian with 3 isolation rooms can handle.
And we are planning for the possibility of additional cases in the coming days.
Sean Rabb, Fox 4 News.